Hey Siri, are ZYN bad for your gums? Why do you even need me? It's right here on your phone. What are you talking about? Just ask ChatGPT.
So, what are ZYNs?
ZYNs are a nicotine salt that's wrapped up into a pouch. And so it originated in Sweden, if I remember correctly, and it's actually kind of an alternative to dip or smoke and, cigarettes, cigars, things like that. So ZYNs are still a way for people who need nicotine to get nicotine, but in what was originally described as kind of a more healthy way.
And do they cause gum irritation and recession, and how serious can it become?
It can, absolutely. Nicotine in particular causes what we call vasoconstriction. What does that mean? The blood vessels in the area shrink, right? And so particularly with long-term use, right? Short-term, a one-off, not a big deal. But over long-term, let's say you're putting ZYNs constantly in, what'll end up happening is the blood vessels in those areas will shrink, so the blood will start to restrict itself. And one of the problems with that is that blood is how your immune system gets in and fights off things, right? The mouth is a dirty place, right? Think of those old, I think it's Orbit. The mouth is a dirty place. Chew Orbit. And so your immune system needs to come in. And one of the things that happens is blood vessels. Well, blood vessels help support the gum tissue. They help kind of the immune system get in there and fight off inflammation. And so nicotine, by causing vasoconstriction, it just limits it. If you think of this, the analogy I would use for patients is think of it like a hose, right? The stronger the hose to fight a fire, the better. In this particular case, it's kind of constricting the hose or tightening the hose, so not as much water is coming.
And do they increase the risk of developing cavities or tooth decay?
They can make your mouth drier. Nicotine salt can absolutely make your mouth drier. Blood constriction in the area can cause gum recession, things of that nature. And so that stuff does make a difference. I would also tell you, the reality of this is, compared to the alternatives, it's probably the best. So, we know about dip and we know about smoking, and those are both horrendous for you, not only for your oral health, but your overall health. Look, is one a problem? It's really not. I mean, you're not going to contract cancer or die because you decided to dip one time or you decided to have a cigarette one time. But continued constant use, daily use, can become very problematic. Your chances for oral cancer development go way up. Chances for cavity or gum disease issues go way up. And that's true across the board for smoking or dip. The other alternative that was really popular is people would try to get off of smoking or dipping, but instead would find themselves addicted to Nicorette or nicotine lozenges. Those aren't great either. I mean, they're definitely healthier, but the gums in the lozenges contain sugar, and sugar is fuel to the bacteria fire. It helps burn and create cavities. So again, those aren't super great, right? The nice thing about ZYNs is they don't have, to my knowledge, they don't have any sugar. They're just nicotine salt in the pouch. They will dry your mouth out, certainly, but you're not also then adding on sugar. So if you were looking for a nicotine thing, I would tell you that's probably the best option outside of a patch, which would go nowhere near your gums, But yeah, that would be kind of the best option.
Can ZYN pouches lead to changes in the color or texture of your gums or teeth?
Yeah, absolutely. And that also goes to, I don't know so much about teeth. I haven't seen as much change in tooth color, but gum color in particular, yes. Vasoconstriction can change the color and the texture of the gums. The gums have to remodel. It's blood supply. Blood is life for the gums. And so the less blood that you're getting into that area, the more problems that you can have with this, and the more it can become an issue. And so you'll get these blood supply issues. So the gums will start to change colors. And we see it a lot in anybody who uses any kind of nicotine product, but particularly in people who dip, or in people who use Nicorette gum and stick it kind of somewhere, or a lozenge and stick it somewhere, or now with ZYNs, we do see that tissue start to change. It becomes a little lighter in color. It becomes a little more, almost kind of, it has this white hue to it. So one of the things I actually recommend to patients who do that is move it around, right? Give areas breaks. And the analogy I use a lot would be, you wear shoes and that's great, but sometimes you take your shoes off, you give your feet a break, right? Sleeping in shoes or constantly putting a ZYN or a dip in the same spot is not great. So if you're going to do it, try to move it around a little bit and give that area a break. Yeah.
Can long-term ZYN use lead to gum disease?
Yes, it can. ZYNs are really new, and we don't have a great amount of research, right? But yes, it can. Vasoconstriction, it can cause issues in the gums. It can absolutely. I would tell everybody, look, is it better than the alternatives? Like if it's, my brain works kind of differently, and I view it this way. You're either going to use nicotine or you're not going to use nicotine, right? It's the only alternative that's better for your gums is a nicotine patch, right? That goes on your arm and doesn't go anywhere near your gums. But if you're going to use nicotine in the mouth, ZYN is probably the best compared to smoking, dipping, or any of the gums or lozenges.
Do certain ZYN flavors pose greater oral health risks than others?
Not that we know of. No. I mean, it's really just an additive that gives it a particular flavor. I would say the stronger the ZYN is, the more vasoconstriction you're getting, right? So if you're using, I don't know, I think they come in 3 milligrams and 6 milligrams, and I don't know if they have a 9 milligram or not. I'm not a ZYN user, but I don't know if they have that. But the stronger it is, the more vasoconstriction you're getting. So that is kind of the one thing I would tell people. Any patient that asks me, I'd say, if you can do less, that would be great. I understand that sometimes the desired effect, the stimulation that comes from nicotine, doesn't work that way. But yeah, absolutely.
So how frequently should someone come visit you if they use ZYNs compared to a non-user?
That's a great question. I would say that depends a lot on a lot of other factors, right? So what do your gums look like? If you have a history of gum disease, we want to see you every 3 months, right? Particularly if you're a ZYN user. We really want to make sure that combine it with the past history that we're not creating more and more problems. If you're somebody who's never had it and never check up your dentist, or you come to me and I say, hey, it looks great, I'm okay with every 6 months. I do tell patients that use them or who dip or things just to pay attention to their tissue, right? Look for any changes. Look for any sores or ulcerations or things like that that don't feel like they're getting better, or any little white lesions. That's a good thing that any patient can do. If you want to use tobacco products, and by all means, as a dentist, I have a moral responsibility to tell you, stop using tobacco products or nicotine products. But if you want to use them, because I'm a realist, it's an addictive substance and people sometimes need it and they like it. And I just tell people, if you're going to use them, do the best thing you can and kind of check yourself, right? Feel around. It's really actually simple. You take your gun and you kind of rub in the area that you typically would place it. See if you feel any bumps that would be different than previous. And that's just a good thing. If all of a sudden you do feel something, call me or call your dentist.
That's all the questions I have for you today, Dr. Lawnin.
Awesome. Thanks.